Hi everybody. So this is the rundown for exam 4 for pediatrics. This exam is 80 questions in length. Let me think what else you need to know about this one. For time frame, I will be giving you 100 minutes. Okay. That should be more than enough time to accommodate for any excessive loading time of the questions or any other kind of extended things that can happen during the exam. So 100 minutes is how long you will get to do the 80 questions. Okay. So let's go ahead and get started with the rundown. So for the dermatologic diseases or skin, you will have 15 questions coming from this chapter. One of them will be on skin integrity. 4 will come from dermatitis, and I'm going to leave that vague because it could be atopic, it could be seborrheic, so it can be any of those dermatitis conditions. So 4 of those. A question on acne, 2 questions on impetigo, 2 questions on lice, 1 on tick bite, 1 on animal bites, and 3 on burns. All right, the next chapter is musculoskeletal. You'll have 14 questions coming from this chapter. 3 will be on fractures. There are other things included besides fractures, and I broke those down a little separately. You'll have 1 question on traction, and you'll have another question on cast care. And your ATI NCLEX loves to ask you questions about both of those, so I made sure to include those on the exam. You'll have 2 questions on scoliosis, 1 on avascular necrosis, 2 on juvenile idiopathic arthritis. You'll have 2 on developmental dysplasia of the hip, 1 on leg calf perthes, and 1 for clubfoot. The next chapter is endocrine. You will have 13 questions coming from this chapter. You will have 1 on hypothyroidism, 2 on hyperthyroidism, 1 on Addison's disease, 2 on diabetes insipidus, and I'm going to take 7 on diabetes, okay, like plain old diabetes mellitus. So that could be your type 1. It could be anywhere from hyperglycemia to hypoglycemia. So a lot of components with diabetes. So I'm going to hit that one pretty hard for the endocrine chapter. Let's see, next chapter, communicable diseases. You're going to have 12 coming from this chapter. So 3 just on vaccinations. So that could be anything from education, but it also could be on if a 6-month-old comes into the clinic, which of the following vaccinations would be appropriate for this child. So you are going to have to know which vaccines go with which age group. And I know that Ms. Hampson or Dr. Hampson for pharmacology used to give you guys a really great PowerPoint on how to memorize those. So I suggest that you take some time and learn your vaccine schedule. You'll also have a question on mumps, 1 on fifth disease, 2 on measles, 1 on pertussis, 1 on varicella, 1 on roseola, 1 on scarlet fever, and 1 just on education about vaccines. Okay, that takes us to the mental health disorders and the reproductive and genetic disorders. I didn't give you a whole lot of lectures on this. The ones that I did are the ones that I hit the hardest. So, psychosocial, you're going to have 5 on child abuse. Okay, you guys know that I talk a lot about child abuse. I gave you guys a pretty detailed lecture on maltreatment of children. So you knew you were going to have a few questions coming on that. So 5 on child abuse, 1 on suicide, 2 on anxiety/panic attacks, 1 on obsessive compulsive disorder. You will have 4 coming for attention deficit hyperactivity disorder or ADHD. You will have 1 on post-traumatic stress disorder. You'll have 1 on phobias, 1 on oppositional defiant disorder or ODD, 1 on impulse control, 1 on eating disorders, and 2 for alcohol slash substance abuse, and that can also extend to prescription drug abuse as well. And then for the developmental, this would be your reproductive genetic disorders. That had a lot of information in it, but I picked very specific things that I wanted you guys to know. Uh, Developmental assessment. So, why do we do those developmental milestones? I have 3 questions on autism spectrum disorder, and I can't remember which chapter that's in, if that's in mental health or if it's in genetic. I always throw it into developmental disorders. So just understand there's 3 questions on autism spectrum disorder. I have 1 question on failure to thrive, and I have 1 question on Down syndrome. Okay, so that should give you 80 questions. Like I said, you'll get 100 minutes to take it. It's all multiple choice, select all that apply, so you don't have to worry about filling the blank or anything like that. The exam is on Friday, May 8th. If you guys have any issues, please get a hold of me before then. Otherwise, do not forget to take it. Otherwise, I think that's it for this recording. So reach out to me, guys. I have office hours today on Monday. I have office hours on Wednesday. And then, of course, you guys know I'm available by email. All right, guys. Talk to you soon.